Hello, I'm going to be demonstrating NG insertion. First, I'm going to tell you the 12 safety rights. You want to verify your client's order, provide good hand hygiene before and after patient care, know your facility's policy and procedures, and assemble your equipment, consult the manufacturer if needed regarding the equipment, knock on your client's door, identify your client with 2 identifiers, assess the overall condition of your client, explain the procedure to your client, raise the bed for good body mechanics, don any PPE if needed, lower the bed upon completion, raise side rails depending on care plan, give the patient their call light, and then document and report any abnormal findings to your charge nurse. Okay, first of all, you want to make sure your patient is positioned correctly, sitting upright. Then you want to apply your gloves. You want to assess the client's nasal passages. You could have them, hold each side and sniff. You could ask them about a deviated septum. Just kind of see if there's any blockages or anything that you notice. Then you would want to measure your tube for insertion, and the way you do that is you take the tip of the tube and you start from their nose and you go all the way up to the top of their ear, and then you hold it and you come down to their xiphoid process, and then you can either use a marker and mark that spot, or you can tape it. So we're going to tape it. So we'll know that's where we need to stop. Okay, all right. And then you would want to give your client a drink of water just to assess their gag reflex and the swallowing. Then you would want to instruct them, you would want to lubricate this before you get started. Then you would want to instruct them to tilt their head back a little bit, and then as you're inserting the tube into the nasal passages on back, you could have them tilt their head down and then keep pushing. If you meet resistance or if they start coughing or anything, you can stop. As you're going down, you could give them a drink of water or tell them to swallow. Once you meet that mark, you would want to anchor it to their nose with a piece of tape, and then you could use the rest of the tube and just kind of anchor it to their gown if you want to. And then, of course, you would want to just kind of monitor the patient, see if if they're tolerating it okay. Once you get it stabilized and in place, you would want to either test the gastric contents, or what most people do now is get an x-ray to see if it's in the proper place and if it's okay to hook up to suction. The order says hook up to intermittent suction, so you would just take this part right here and hook it up to the suction machine on intermittent suction. Okay, next we have an order to do, let's see, gastric lavage via NG with normal saline until contents are clear. Okay, so I would come back in the room, wash my hands, put on a clean pair of gloves. What I would do then is I would have my normal saline and my syringe, and I would disconnect this from suction, and then I would take my saline and my syringe, I would take about 25 cc's and well, I would have this off, but 25 cc's of saline, and then you could aspirate to see if it was clear, and if it wasn't, you could do it again. 25 to 50 cc's of flush, aspirate again until the contents are clear. And then once you do that, you can go ahead and disconnect and hook it back up to the intermittent suction. Make sure your patient is tolerating well, document, of course you would document that you inserted it to the NG, and then you would go back and look at your order, and we have an order to administer Glucerna 1.5, 100 milliliters with 50 milliliters of flush, and just as long as there's no residual, as long as the residual is less than 150. So of course you would come back, wash your hands, put on a clean pair of gloves. To do the feeding, of course you would disconnect from your suction. Say this is your Glucerna 1.5, and you would take your syringe. Of course, like I said, this would be off. There we go. And you would pour the 150 cc's of Glucerna in there and just let gravity do its thing. And then you would take your normal, or your water, 50 cc's of water, flush it. You would also check your, you would want to check the gastric contents before feeding, and if it was 150, over 150, you would call the doctor, and then during feedings, if you got back over 150, you would want to call the doctor. You just want to make sure that your residual is less than 150. And just every 4 hours, feed them and flush them, and once you're done, you know, just hook them back up to the intermittent section or clamp it, whatever they have ordered. Just assess it, make sure they're tolerating it well, make sure the belly's okay, and once you're done, you just document and go wash your hands. Thank you.